My name is Deb Simon, and I am a OBGYN physician, and I am based out of La Crosse at Gunderson Health System. And I come here every month to do specialty services, gynecology services here, and I do surgery and clinic here at Crossing Rivers.
My name is Jamie Peterson. I'm a PA or physician assistant. I work at Gunderson Health System in La Crosse, Wisconsin, and I come down here to do gynecology care at Crossing Rivers.
Pap smears are screening for cervical cancer, and what we're really looking for most of the time, because we have such good screening in our country, is we're looking for precancer changes. Those changes are called dysplasia. That is not cervix cancer, it is precancer. It does not always become cancer, but it has the potential to. And so a pap smear is done usually by a primary care provider, and it's a screen. And when it comes back abnormal, depending upon that abnormality, a patient will get sent possibly for colposcopy. And colposcopy is where we use a light and a scope and look in at the cervix for certain changes that may suggest the presence of a precancer. And if we see that, we would do a biopsy. And if the biopsy came back such that we feel that treatment is better than watching, which we do sometimes watch some of these changes, then we can do a treatment where we do a small excision of part of the cervix. It's called a LEEP procedure. And that can be done in the office. And so that hopefully completely treats the area that's affected. The other factor that most people know about, which is hard to explain sometimes, is that most cervix precancer changes are associated with a virus called human papillomavirus, or HPV. And so we know enough about it now, and we know that most people will be exposed to it throughout their lifetimes, that we vaccinate our teenagers and preteens. We call it kind of the common cold of sex, meaning that almost everyone will be exposed to it through their lifetimes. And some people's bodies will do a good job of fighting that virus off, and so they may have been exposed to it but never have an abnormal pap smear or a change on their pap smear to suggest any sort of infection. And some people will have that expressed. Maybe they didn't have it for 20 years and now they do. It doesn't mean a new exposure. So it's hard to explain, but it is the virus that's associated most strongly with cervix cancer and pre-cancer changes.
Occasionally we will do a hysterectomy for recurrent abnormal pap smears if someone's done childbearing, and that's been a recurrent problem.